Seeing the process of a small baby, a small life coming into this world, the feeling is very surreal. Hi guys, this is Sneha, third year medical student from Bangalore. In this video, I'm going to share 1 month of experience in obstetrics and gynecology postings. So for our OBG postings, we were posted in Ghosha Hospital, which is attached to our college but not in the vicinity of our college. So we have to go approximately 1 to 1.5 kilometers from our college. So our postings begin at 8 o'clock in the morning and it's from 8 to 11. On the first day of the postings, I reached there by about 8:15 to find no one there except one of my classmates and the cleaning staff. So the OPDs were not yet open and there were a lot of patients waiting outside the hospital. But nonetheless, the labor room was bustling with activity. So we decided to go to the labor room and we inquired with a few of the PGs there. They said that you have to wait for HOD. Since this hospital was away from our college, we didn't know the exact details of where is the ward, where is the OT and stuff. So we decided to explore the place ourselves until the HOD arrives. Me along with my friends, we just went around the hospital. Then our HOD arrived by around 9 o'clock or 9:15ish, and she briefed us about the postings. We reported to her, and then she told us about the pattern of the classes that would be taken. She said that every day from 8 to 9 we would be posted in the labor room, and we had to see the process of labor. We have to take the cases in the labor room. And from 9 to 10 we would be having the classes wherein they would teach us the symptomatology and the case taking part of OBG. Then again from 10 to 11 we were divided unit wise, and we would be having either OPD or minor OT or major OT. Then after briefing us everything, again she took us on a mini tour of the hospital. Again she showed us the OT, the minor OT, the OPDs, the blood banks and all the procedures, the antenatal ward, the postnatal ward and everything. So it was like a second time tour of the hospital for us. We were in the antenatal ward. One of the PGs came to call our HOD as one of the patient was in active labor, and she wanted to show us the process of active labor. So we went there, and on the very first day of our postings we got to see a case of normal vaginal delivery which was at term. And yeah, the feeling was very surreal. It was, though we were excited, we were a little bit anxious or nervous also, since it was the first time we were seeing. Actually we were supposed to see it during our second year as well, but since it was lockdown we had only online postings, if that makes any sense. So we couldn't see any cases of normal delivery or anything for that matter of fact in OBG. So we saw a case of normal delivery on the very first day. As soon as the baby was delivered, it was kept for a few minutes on the mother's abdomen. Then the umbilical cord was cut, and all the process for the first time we got to see it firsthand. Then the baby was cleaned, wrapped in a cloth and kept in the warmer. After all this, it was time for our classes regarding history taking. So on the first day we were taught about the basics of history taking, the pro forma of the obstetric case. Since in this term we had only the obstetric case taking, so we were taught about all those things. Then from the next day, as we were instructed, we were following the same routine, labor room and then the classes followed by either OPD or the OT. So the next day we had, our unit had the OPD. We went to the gynecology OPD. It was our very first day in the gynecology OPD and we didn't know anything. Our teacher was examining a case of vaginal discharge, and then we were told to don the gloves. We wore the sterile gloves, and then we were told to take the pap smear. It was our first day and we didn't know anything. One of our PGs then taught us how to take the smear and stuff, to take the endocervical smear and ectocervical smear separately, and we were taught the basics of this in the very first day of our OPD. And we were taught about the Sims speculum, which is used for the PV examination, and the type of spatula, Ayer's spatula, which is used to take the pap smear. So after it was very exciting to take this smear, like these small procedures, when we are allowed to do it. In the next few days we got to visit the OT. Even though we do absolutely nothing in OT, we are just like space occupying lesions in the OT, but still that process of donning in the scrubs and entering the OT, it gives a different kind of excitement, a different kind of feeling. In OT, the first case we saw was that of a patient with a massive fibroadenoma of the uterus. So the hysterectomy was done for the same, and the size of the fibroadenoma was really huge. It was almost the size of a baby. It was 2.5 kgs. In the next few days of the OTs and all, we saw various cases of tubectomies. We saw the tubectomy, we were briefed about the anatomy of the uterus, the blood supply of the uterus, and we were shown the various parts of the uterus and the fallopian tube. Along with that, we were also taught about the ligaments and supports of uterus. So it was quite interesting, and we got to revise a lot of things during the OT. Almost 3 weeks being completed, we couldn't get to see even a single case of C-section. Like, it used to be scheduled either earlier or after our postings got over by 10 or 11. So we never got to see a C-section until 3 weeks, and we were very eager to see that. Finally, on the last week of our postings, we got to see a C-section. Not completely actually, because by the time we went, the incision was already given and the baby was out. We got to see the suturing part, which is the most time-consuming part in the C-section, and the subcuticular sutures and all. It was very delicate, and it was a treat to the eyes to watch that, to watch our professors put the sutures with such precision. Then that case was of preterm baby. Actually, it was of 36 weeks of gestation, as I remember, and it was it had the whitish vernix on its surface. During our obstetric history taking, we were also taught about the various pelvic grips, how to feel for the baby parts, and how to find out the presentation, if it was a cephalic presentation or if it is a breech presentation. We were taught about all the grips, and that's basically the Leopold's maneuvers, and to localize for the fetal heart sounds and stuff. One of the days of our postings, we attended the ultrasound department in the Gosha hospital, and there we learnt about the significance of the early anomaly scan and stuff, and how it can be used to detect Down syndrome and various other anomalies. We learnt about the importance or the significance of ultrasound in pregnancy. So almost on the last week of our postings, we saw a primi gravida. She was in active stage 2 labor. The cervix was dilated, and they were expecting her to deliver by 8:30, but the process got prolonged until 10:30, and the baby's head was out. We could see it, but she couldn't deliver it. She tried very hard, and she was finally very tired. But then after a little more efforts, she could deliver it normally, and it was a term baby. Because of the prolonged stage 2 labor, there was swelling in the baby's head, which is called as caput succedaneum in the medical terms. It is nothing to worry, it's physiological. Yeah, we had to say the mother that it would go and there's no need to worry. During this case of primi, which was obstructed, our senior professor finally came, as she was not delivering, and then by the process of delivering, the amniotic membrane just ruptured, and there was amniotic fluid all over our professor and one of my friends' clothes and shoes. More than us, it was all over our professor's sari and dress and everything. So it was we were also taught about the active management of the third stage of labor, which is an essential part of post-natal care. So after the delivery, there needs to be removal of placenta by controlled cord traction. One of our classmates also performed this controlled cord traction and removal of placenta. We don't need to actually remove it, but because by giving controlled cord traction, the placenta will come out, and we need to check for the cotyledons and complete placenta and then discard it. So that process, and we were taught about the 3 major steps of active management. We also saw episiotomy being given. Like many a times we saw this episiotomy over the course of 1 month, and we were taught about how the episiotomy suturing is done. So episiotomy is basically an incision given to widen the birth canal and facilitate easy passage of the baby. Then we were taught about the various layering of the various layers of suturing that is done in the episiotomy. So one of the interesting but little challenging part was to localize the fetal heart sounds. At the beginning of our postings, we found it very difficult and we couldn't do it. But by the end of 2 weeks or the halfway around 1 month, we could learn to localize the fetal heart sounds. Sometimes we mistook the uterine artery auscultation to be the fetal heart sounds, but yeah, finally we were taught to differentiate between the two. Whenever we were told to take any antenatal case, we used to search for the fetal heart sounds. Sometimes we used to find, but in case of some obese females, it is difficult to localize. And then it was a task to find the fetal heart sounds. And at the end of 1 month, we had to give an end posting exam or assessment to know, like they would assess us based on how much we have learned over the course of this 1 month, and our history taking and examination skills would be assessed. We got a case of pregnancy induced hypertension, and she also had a history of preterm delivery. She was in her 8th month of pregnancy. We took the case, we did the examination, and then everything went on smoother than expected. The viva was also pretty okay, and as they say, all is well that ends well. So with this, we came to an end of our obstetrics and gynecology posting. It was quite interesting. We learned a lot of new things, and we learned a lot of small procedures, though we didn't perform many things, but still it was very exciting and interesting. I hope you guys enjoyed this video. That's it for today. Until next time, take care.